Welcome back to the channel. If you're new here, we focus on practical, honest health information specifically for adults over 60. No gimmicks, no scare tactics, just real information you can use to live a longer, healthier, more independent life. Today, we're talking about something that affects tens of millions of seniors across America every single day. We're talking about a category of medication that sits in nearly every medicine cabinet in this country. It's sold without a prescription. It's recommended casually by friends, family members, and even some healthcare providers who may not fully consider the risks for aging hearts. I'm talking about NSAIDs. That stands for Non-Steroidal Anti-Inflammatory Drugs. Now, that's a mouthful, so let me make it simple. NSAIDs include brand names you absolutely know. Ibuprofen, that's Advil and Motrin. Naproxen, that's Aleve. And there are several others, including prescription-strength versions that millions of seniors take for arthritis, joint pain, back pain, and general inflammation. These medications are effective. Nobody is disputing that. They reduce swelling. They ease pain. They help people get through their day. But here's the problem, and this is what cardiac surgeons, cardiologists, and researchers have been raising alarm bells about for years now. For people over 60, especially those with any history of heart disease, high blood pressure, or other cardiovascular risk factors, regular use of these common painkillers can be genuinely dangerous. And most people simply do not know. So today, we're going to break down exactly what happens inside your heart and blood vessels when you take these medications regularly. We're going to talk about the specific warning signs you should never ignore. And most importantly, we're going to discuss safer alternatives, real, practical options that can help manage your pain without putting your heart at risk. Let's get into it. Let me paint a picture for you that a prominent cardiac surgeon shared during a medical conference. He said something that stuck with everyone in the room. He said, "I operate on hearts every single week. And when I sit down with my patients afterward and go through their medication history, I am stunned by how many of them were taking over-the-counter ibuprofen or naproxen daily, sometimes for years, with no idea that it was contributing to the very problem that landed them on my operating table." Think about that for a moment. Now, here's what the research tells us. Multiple large-scale studies, we're talking about studies involving hundreds of thousands of patients, have shown that regular use of NSAIDs increases the risk of heart attack by anywhere from 20 to 50%. Some studies suggest even higher numbers for certain populations, particularly adults over 65. And it's not just heart attacks. NSAIDs have been linked to increased risk of stroke, heart failure, dangerously elevated blood pressure, and dangerous interactions with medications that many seniors are already taking. The FDA, the Food and Drug Administration, actually strengthened their warning labels on NSAIDs back in 2015. They stated clearly that NSAIDs can increase the risk of heart attack or stroke, and that this risk can occur as early as the first few weeks of use. The risk increases with longer use and higher doses. But here's the thing many seniors don't realize. That warning label? It's in tiny print. Most people don't read it. And because these drugs are sold over the counter, without a prescription, many people assume they must be completely safe. After all, if they were dangerous, wouldn't you need a doctor's permission to take them? Unfortunately, that assumption can be a costly one. Okay, let me explain what NSAIDs actually do to your heart in simple terms, because understanding the why behind this is really important. Your body produces natural substances called prostaglandins. Now, prostaglandins do many things. Some of them cause inflammation and pain. That's the part you feel when your knee aches or your back hurts. But other prostaglandins do something very different. They protect the lining of your stomach. They help your kidneys function properly. And this is the critical part. They help keep your blood vessels relaxed and open, and they help prevent dangerous blood clots from forming. When you take an NSAID, the medication blocks the production of prostaglandins. All of them. The ones causing your pain, yes, but also the ones protecting your heart, your blood vessels, your kidneys, and your stomach. So here's what can happen inside your body when you're regularly taking these medications. First, your blood pressure goes up. NSAIDs cause your body to retain sodium and water. This increases the volume of blood your heart has to pump. For a senior who already has high blood pressure, and that's roughly 2 out of every 3 Americans over 60, this can push blood pressure into dangerous territory. And here's what makes this especially tricky. If you're already taking blood pressure medication, NSAIDs can actually make that medication less effective. So you could be faithfully taking your blood pressure pills every morning, but if you're also popping ibuprofen for your knee pain, your blood pressure medication may not be doing its job properly. Your doctor might even increase your dose, not realizing that the real problem is the ibuprofen. Second, your risk of blood clots increases. Remember those protective prostaglandins I mentioned? Some of them help prevent platelets, tiny cells in your blood, from clumping together and forming clots. When NSAIDs suppress these protective prostaglandins, your blood becomes stickier. Clots form more easily. And when a clot forms in a coronary artery, one of the arteries feeding your heart, that's a heart attack. When it happens in an artery going to your brain, that's a stroke. Third, your kidneys take a hit. Your kidneys depend on prostaglandins to maintain proper blood flow. NSAIDs can reduce blood flow to the kidneys, leading to fluid retention, swelling in the legs and ankles, and in severe cases, kidney damage. And when your kidneys aren't working well, that puts additional strain on your heart. It's a vicious cycle. Fourth, if you're taking blood thinners, and many seniors are, NSAIDs create a dangerous interaction. Millions of seniors take medications like warfarin, also known as Coumadin, or newer blood thinners like Eliquis or Xarelto. Adding an NSAID to the mix dramatically increases the risk of serious bleeding, including internal bleeding that can be life-threatening. Many seniors don't realize that their over-the-counter pain pill can interfere with their prescribed blood thinner. They never think to mention it to their doctor because, in their mind, it's just ibuprofen. It's not a real medication, but it is. And the consequences can be severe. Now, I want to talk about specific warning signs. If you've been taking NSAIDs regularly, and by regularly, I mean several times a week for more than a couple of weeks, please pay attention to these signals your body may be sending you. Swelling in your ankles, feet, or legs. This can indicate fluid retention caused by the medication affecting your kidneys. Many seniors chalk this up to just getting older. But sudden or worsening swelling is your body waving a red flag. Unexplained shortness of breath. If you find yourself getting winded doing things that didn't used to bother you, climbing a short flight of stairs, walking to the mailbox, even getting dressed in the morning, this could be a sign that your heart is under strain. Chest pain or pressure. This one should always be taken seriously, regardless of the cause. But if you're experiencing any chest discomfort and you've been taking NSAIDs regularly, please tell your doctor immediately. Headaches that won't go away or sudden severe headaches. This could be a sign of dangerously elevated blood pressure. Dark or bloody stools. NSAIDs are notorious for causing stomach and intestinal bleeding, especially in seniors. If you notice your stools are darker than usual, or if you see any blood, this is an emergency sign. Unusual fatigue or weakness. When your heart is struggling, when your kidneys are compromised, or when you're losing blood internally from stomach irritation, you'll feel exhausted. Not just normal tiredness, a deep, heavy fatigue that rest doesn't fix. Many seniors ignore these signs. They tell themselves it's just aging. They don't want to bother their doctor. They don't want to seem like they're complaining. But I'm telling you right now, these signs matter. Your body is communicating with you. Please listen to it. Now, let me pause here for a moment. If you're over 60, or if you're caring for an elderly parent, spouse, or loved one, this information could genuinely be life-saving. I'm not saying this to be dramatic. I'm saying this because every single year, thousands of seniors end up in emergency rooms, and some don't come home because of complications from medications they thought were completely harmless. If this video is helpful to you, please take a moment to hit that subscribe button. Share this video with a friend, a family member, a neighbor, anyone over 60 who might be reaching for that bottle of ibuprofen or naproxen every day without realizing the risk. You could be the reason someone has a crucial conversation with their doctor. You could be the reason someone avoids a heart attack. All right, now let's get to the part you've been waiting for. What can you use instead? This is where I want to give you real, practical solutions. Because here's the truth: the pain is real. Arthritis is real. Back pain is real. Nobody is telling you to just suffer through it. The goal is to manage your pain effectively while protecting your heart. And fortunately, there are several options. The first alternative is acetaminophen, also known as Tylenol. For many types of pain, especially mild to moderate joint pain, headaches, and general aches, acetaminophen can be surprisingly effective. Unlike NSAIDs, acetaminophen does not raise blood pressure, does not affect your kidneys the same way, does not increase clotting risk, and does not interact with most heart medications. Now, acetaminophen is not perfect. It doesn't reduce inflammation the way NSAIDs do, so for conditions where inflammation is the main problem, it may not be enough on its own. And you do need to be careful with the dosage. Taking too much acetaminophen can damage your liver. The general recommendation is not to exceed 3,000 milligrams per day for older adults, but always check with your doctor for the right dose for you, especially if you have any liver conditions or if you consume alcohol. But for many seniors, switching from daily ibuprofen to acetaminophen under their doctor's guidance can significantly reduce cardiovascular risk while still providing meaningful pain relief. The second alternative is topical pain relievers. This is one that many seniors overlook, and it's a shame because topical treatments can be remarkably effective, especially for localized pain, a sore knee, an aching shoulder, a stiff neck. There are topical NSAIDs like diclofenac gel, which is available both over the counter and by prescription. The beauty of a topical NSAID is that very little of the medication enters your bloodstream. It works right where you apply it, targeting the pain locally without the systemic effects that oral NSAIDs cause throughout your body. Studies have shown that topical diclofenac provides comparable pain relief for conditions like knee osteoarthritis, while carrying a fraction of the cardiovascular and gastrointestinal risk. There are also non-NSAID topical options: capsaicin cream, menthol-based rubs, and lidocaine patches. These work through different mechanisms and can provide real relief, especially when used consistently. The third alternative is physical therapy and gentle exercise. I know. When you're in pain, the last thing you want to hear is you should exercise more. But hear me out, because the science on this is overwhelming. Regular, gentle movement, walking, swimming, water aerobics, tai chi, gentle yoga, simple stretching routines has been shown to reduce chronic pain, improve joint function, strengthen the muscles that support your joints, and actually reduce inflammation over time. Exercise also strengthens your heart, lowers blood pressure, improves circulation, and boosts your mood. A physical therapist can design a program specifically for your body, your pain points, and your fitness level. Many Medicare plans cover physical therapy, so cost doesn't have to be a barrier. Think of it this way: NSAIDs mask the pain temporarily. Exercise and physical therapy actually address the underlying cause. One is a band-aid. The other is a long-term solution. The fourth alternative is heat and cold therapy. Simple? Yes. Effective? Absolutely. A warm compress or heating pad on stiff, aching joints in the morning can increase blood flow and loosen things up. An ice pack after activity can reduce swelling and numb sharp pain. These cost almost nothing, have zero side effects, and can be used as often as you need. The fifth alternative is to talk to your doctor about prescription options. For seniors with more severe pain, especially from conditions like advanced osteoarthritis or rheumatoid arthritis, there are prescription options that may be safer for your heart than over-the-counter NSAIDs. Certain medications, joint injections like corticosteroid shots or hyaluronic acid injections, and other targeted therapies can provide significant relief without the cardiovascular risks. The key here, and I cannot stress this enough, is to have an honest, thorough conversation with your doctor. Tell them everything you're taking. Everything. Including over-the-counter medications, supplements, vitamins, and herbal remedies. Don't assume something doesn't count because you bought it at the drugstore without a prescription. Your doctor can look at the full picture: your heart health, your kidney function, your other medications, your specific type of pain, and help you find a pain management approach that's both effective and safe for your heart. Now, I want to address something that causes a lot of confusion among seniors. Some of you may be thinking, wait, isn't aspirin an NSAID? And didn't my doctor tell me to take a baby aspirin every day for my heart? Great question. Yes, aspirin is technically an NSAID, but it works differently from ibuprofen and naproxen when it comes to cardiovascular effects. Low-dose aspirin, typically 81 milligrams, has antiplatelet effects that can help prevent blood clots and reduce heart attack risk in certain patients. That's why some doctors prescribe it for cardiovascular protection. However, and this is important, recent guidelines have actually changed on this topic. Many medical organizations now recommend against routine daily aspirin for heart disease prevention in seniors over 70 who have not had a previous heart attack or stroke because the bleeding risks may outweigh the benefits. The bottom line? Don't start, stop, or change your aspirin regimen without talking to your doctor. This is a nuanced medical decision that depends on your individual health profile. Before we wrap up, let me give you a simple action plan. Things you can do starting today. Step 1. Go to your medicine cabinet right now, after the video, and look at every single over-the-counter medication you're taking. Check the active ingredients. You might be surprised to find that NSAIDs are lurking in places you don't expect. Some cold and flu medications, some PM sleep aids, and some combination pain relievers contain ibuprofen or naproxen. You could be taking NSAIDs without even realizing it. Step 2. Make a complete list of every medication, supplement, and over-the-counter product you take. Bring that list to your next doctor's appointment. If you don't have an appointment coming up soon, call your doctor's office and ask for a medication review. Most primary care doctors are happy to do this, and it's one of the most important things you can do for your health. Step 3. Never increase your NSAID dose on your own. If the recommended dose isn't controlling your pain, that's a signal to talk to your doctor, not to take more pills. Step 4. If your doctor agrees that you should stop or reduce your NSAID use, don't just quit cold turkey without guidance. Your doctor can help you transition to safer alternatives gradually and effectively. Step 5. Pay attention to your body. If you notice any of the warning signs we discussed earlier, swelling, shortness of breath, chest discomfort, unusual fatigue, dark stools, don't wait. Don't hope it goes away. Call your doctor. Go to the emergency room if necessary. Early intervention saves lives. Let me bring this all together. NSAIDs like ibuprofen and naproxen are incredibly common medications. They're in almost every home in America. And for short-term, occasional use in otherwise healthy individuals, they can be appropriate. But for seniors, for those of you over 60, especially those with high blood pressure, heart disease, kidney issues, or those taking blood thinners, regular, long-term use of these medications carries real and serious cardiovascular risks. The good news is that you have options: acetaminophen, topical pain relievers, physical therapy, heat and cold therapy, prescription alternatives tailored to your needs. You do not have to choose between living in pain and putting your heart at risk. There is a middle path, and your doctor can help you find it. Knowledge is power. And today, you have more knowledge than you did 10 minutes ago. You understand what these medications do inside your body. You know the warning signs to watch for, and you know that safer alternatives exist. That puts you in a stronger position to protect your health, to advocate for yourself, and to have smarter conversations with your healthcare team. I want you to remember something. Your heart has been beating for you every single second of every single day for over 60 years. It has carried you through decades of life, through joy, through hardship, through everything in between. It deserves your protection. It deserves your attention. And something as simple as reconsidering what pain medication you reach for can make a profound difference in how many more years that incredible heart keeps beating for you. If this video opened your eyes to something you didn't know before, please hit that like button. It helps more seniors find this information, and it truly makes a difference. If you haven't already, subscribe to this channel and tap that notification bell. We release new videos every week focused on health topics that matter most to adults over 60, heart health, joint health, brain health, medication safety, nutrition, and so much more. Share this video with someone you care about. Send it to your spouse. Text it to your adult children. Share it in your church group or your community center. You never know who might be taking ibuprofen every single day without realizing the risk. And I'd love to hear from you in the comments. Are you someone who's been taking NSAIDs regularly? Did you know about these risks? Have you found alternative pain management strategies that work for you? Drop a comment below. Your experience might help someone else who's watching. Thank you for spending this time with me today. Thank you for caring enough about your health to stay informed. Take good care of yourself. You are worth it. I'll see you in the next video.